All right, everyone. I'm going to go ahead and get started. Um, Today's session, we're going to go over, we're going to start by going over some suicide data specific to Wyoming. And then we have guests from the National Suicide Prevention Lifeline, Vibrant Health, and they're going to talk about the Lifeline centers in Wyoming. And we also have Dr. McKeon from SAMHSA, who's going to talk to us about whatever he wants to talk to us about, hopefully about 988. And I'm going to go ahead and jump in. So, wanted to start by giving everybody a little basic info about suicide in Wyoming. So, as many of you know, Wyoming has the second highest suicide rate in the US, and our rate per 100,000 is 25.4 in comparison to the national rate of 14.8. We have actually been in the top 5 highest states with the highest rate since 1996. So these are some of the risk factors that I feel are very that impact Wyoming specifically. So local epidemics of suicide. So we know Wyoming is the least populous state in the country, and a lot of our communities are very, very small. I saw a visual yesterday that somebody had how many, it was like all of Cheyenne and then several other towns across Wyoming that could fit into the stadium for the Broncos. So like when a suicide occurs in one of these smaller communities, the impact is often felt a lot more intensely. We also have isolation or a feeling of being cut off from other people. We know that this is a huge risk factor, and especially here in Wyoming, and even more so now that we're dealing with COVID. So a lot of our communities are very isolated. A lot of people live out on ranches where they're very far away from their nearest neighbor, or they work in the oil fields all by themselves out in the middle of nowhere. And this is a huge risk factor for suicide. Also, barriers to accessing mental health treatment. Even though we have behavioral health centers in every county, it can oftentimes be, some of our counties are very large, and it can oftentimes be very difficult for people to access mental health care. Loss. So a big one is our economy in Wyoming is based on a boom and bust economy. So what that basically means is a lot of our main industries are tied to energy. So oil, gas, coal, and as those businesses shut down, those end up resulting in pretty large layoffs. And we have seen, since we've started abstracting data for the National Violent Death Reporting System, that a lot of our suicides have been tied to loss of employment or financial distress. Also, easy access to lethal means. So Wyoming has the highest firearm ownership per capita in the country, and unwillingness to seek help because of stigma attached to mental health and substance abuse disorders or to suicidal thoughts. So everyone in Wyoming can definitely speak to the cowboy up mentality, pull yourself up by your bootstraps. People don't need to go to therapy. People don't need to seek help. And that's definitely something that I know a lot of people in our communities across the state have been working very hard to kind of break down that stigma. But it's still something we have to keep working on. So in Wyoming, I just wanted to share this with you guys really quickly. This is our ranking by age per 100,000. So the suicide rates per age group. And as you can see, the majority of our suicides are with older adults and middle-aged men. And then as far as means and gender, obviously the overwhelming majority of our suicides involve firearms, and that's higher in males, but it's really not, it's just by far and away the most commonly used means in Wyoming. And then you see back here, female. So the females are much less likely to use a firearm, but conversely down here, much more likely to use poisoning. I did want to end on some happier news, because a lot of times our information about suicide in Wyoming is kind of frustrating. So we have had the past 2 years, we've been working on the community prevention grants, and the Department of Health puts out $8 million around the state to work on the topic areas of suicide prevention, underage drinking and other drugs, tobacco, and adult binge. And we know that there's an intersection, obviously, between substance abuse and suicide. So these, even though they're separate priority areas, they still tie in with each other. And we have 22 CPSs, or community prevention specialists, in 22 of the 23 counties. I usually forget that there's one county that just opts out, but and then we have a total of 23 different evidence-based strategies being initiated across the state of Wyoming specific to suicide, for an average of 5 per county. And even though we are really far apart from each other, we do have resources in every county. So you can go to our website and get connected to community mental health centers, or contact us and we can put you in touch with your community prevention specialist. All right, so I'm gonna go ahead and turn it over. Who's gonna go next, Shari?
Yeah, it's gonna be me. Thank you so much, Lindsay.
Of course.
And I'm not sure, okay, I don't have any slides, so I'm just gonna speak for a moment. So my name is Shari Sinwelski, and I'm Vice President of National Networks for Vibrant Emotional Health. And Vibrant is the organization that administers the National Suicide Prevention Lifeline through funding from SAMHSA. And so I also work as the Deputy Director for the National Suicide Prevention Lifeline. I just wanted to thank you, Lindsay, and everyone for inviting the Lifeline to participate in this webinar today. You wanted to end on some exciting notes, Lindsay, and I'm going to continue to add to those exciting notes, which is that I'm really grateful to be able to say that as of right now, we've got 2 new centers within the Lifeline in Wyoming. So for those of you who don't know, and Laura's going to talk a lot more about the Lifeline in just a moment, but for those of you who don't know, the way the Lifeline works is that it's a 1-800 number that's supported by crisis centers in local communities. And so recently, both Central Wyoming Counseling Center as well as Wyoming Lifeline, the Henny Group, are 2 brand new centers within the Lifeline network. And we're really excited about that, because with the addition of these 2 centers, we can now say that there are Lifeline affiliated crisis centers in every state in the country. So bringing on those 2 centers in Wyoming has given us coverage across the entire country. Without our centers, there would be no Lifeline. We rely on our local centers to take these calls. And so previously, calls had been going to the backup centers, and now we're really happy to say that callers in Wyoming will be able to reach crisis centers and counselors that are located in Wyoming as well. I'd also like to just really say thank you and show our appreciation for the leadership and the support and the investment from Governor Gordon and the Wyoming legislature. I know that a lot of work's been done to make this happen, including work with the Wyoming Department of Health, including Stephanie Pyle, Lindsay Martin, who's here with us today, the Wyoming chapter of the American Foundation for Suicide Prevention, and of course the centers themselves, Central Wyoming Counseling Center and the Henny Group, Wyoming Lifeline. So we're so excited to have them on board, and thank you guys so much for your commitment to suicide prevention in Wyoming and also to the Lifeline. And with that, I'll hand it over to Laura, who's going to talk a little bit more about the Lifeline. Laura, can't hear you.
All right, looks like I'm muted or was muted, but thank you. Thank you, Shari, and thank you, Lindsay, for inviting us to participate today. Like Shari said, we are very grateful for your leadership and the department's leadership and to talk more about the Lifeline in Wyoming. So I'm going to share my screen so you all can see the slides we have prepared. So we're going to talk today about crisis call centers that are part of the Lifeline, and we're going to talk about that in the context of both 988, which Richard will cover, and as well as the impact of COVID-19. So I just want to start this presentation by letting you all know that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, or SAMHSA, or the U.S. Department of Health and Human Services. So I just wanted to get that out of the way as a disclosure, and really talk about the Lifeline and the mission that's central to the Lifeline. And so prior to the Lifeline being established in 2005, there was a patchwork across the country of state and county local crisis intervention lines. And so an individual may live in a county or have lived in a county where none of those resources existed, or lived in a county where they had all three options. And so the mission of the Lifeline is that no matter where a person may live in the United States, that they are able to reach a 24/7 free crisis line, helpline, to get that access to services. So that is the mission of the Lifeline, and that's why we're so excited to have centers now in every state, with the 2 coming on board in Wyoming, so that callers can have that local connection. And so Lifeline, as Shari mentioned, is truly a local safety net. Our network is only as strong as our centers, and so we're so grateful to have a very robust network of centers. All of the centers in the network are independently owned and operated. And so they are funded from a variety of sources, including fundraising or local or state investment in the centers. Callers to the Lifeline are able to access the Veterans Crisis Line, as well as a Spanish sub-network. And as Shari mentioned, funding is provided by SAMHSA through congressional appropriations. So Vibrant Emotional Health is the current administrator of both the National Suicide Prevention Lifeline and the Disaster Distress Helpline. And we'll talk a little bit about both. So with the addition of Central Wyoming Counseling Center and the Henny Group Wyoming Lifeline, we have over 170 centers in the Lifeline network across all 50 states. Call centers that join the Lifeline network are able to decide their call catchment areas. And so that ensures that the center is able to effectively serve callers to the Lifeline based on a business model that works for them based on their funding level. And so in Wyoming, the call centers have coverage based on county or statewide, and then hours of operation. And there are clinical benchmarks that centers must meet in order to join the Lifeline. And we have a clinical staff within the Lifeline that work very closely with centers to ensure that they have the proper accreditation, training, and policies in place to help callers before they even take their first Lifeline call. So as Shari mentioned, just wanted to highlight the 2 centers in Wyoming, the Central Wyoming Counseling Center and Wyoming Lifeline, the Henny Group. And so we're very proud to have them as part of the network. So I just wanted to walk through how our call routing works. And so when an individual calls 1-800-273-TALK, they hear a greeting, which directs them if they are a veteran or calling in regards to a veteran, they can press 1 to be routed to the Veterans Crisis Line, and that's operated by the VA. They can press 2 to be routed to our Spanish subnetwork if they feel more comfortable speaking in Spanish. And if a caller does not press 1 or 2, then they are routed to their local crisis center. So before, a Wyoming caller, if they did not press 1 or 2, they were routed to our national backup network, which is a collection of currently 9 centers who answer calls around the country. But now they will be routed to either Central Wyoming Counseling Center or the Henny Group based on when they call in the area from which they call. And so, you know, the kind of next bullet here is that if the local center is unable to answer that call, then that call is pulled back and routed to one of 9 centers that make up our national backup network. And that is to ensure that callers are able to connect with a crisis counselor, that folks aren't waiting on hold for too long. And we want to make sure that everyone in need is able to access and reach a counselor. So that is Lifeline call routing generally. Lifeline is one of, if not the most promoted suicide prevention number in the United States. There are, as I mentioned earlier, a collection of state or local helplines, but by and far, the Lifeline number 1-800-273-TALK is the most well-known suicide prevention number. And here is just a collection of news stories highlighting the National Suicide Prevention Lifeline and some of the mass media kind of best practices. So generally, whenever there is a TV program that touches on suicide or a news article, it's generally considered best practice to provide the number for the Lifeline so that folks know where to turn to for resources if they are feeling suicidal or know someone who may be feeling suicidal. And not only is the Lifeline kind of the most recognized suicide prevention number, but it's also the gold standard in suicide prevention interventions. So this is kind of a quote from a 2014 evaluation of 10 California crisis centers from the RAND Corporation, and it just highlights that callers to the Lifeline member crisis centers were more likely to be assessed for suicidality and show reductions in distress by the end of the call. And that's because through the great work with SAMHSA and other research partners like Columbia University, we are able to evaluate how centers are performing, what are the, if we have reduced distress within callers, use that research and feedback to improve the line continuously. So we're constantly updating based on best practices and what evidence-based practices. So in 2019, there were 4,701 calls to the Lifeline from Wyoming. And as Shari mentioned, prior to the 2 call centers coming on board, all 4,701 calls were going to our backup network. And so they were being answered, you know, maybe in Nevada, maybe in California. There wasn't a local connection to local resources. As of September 15th of 2020, there have been 2,314 calls to the Lifeline from Wyoming. And I also want to note that this does not include callers that pressed 1 to access the Veterans Crisis Network or pressed 2 to access the Spanish subnetwork. So those callers are not contained in this data. And as of September 15th, Wyoming, with the addition of the 2 new call centers, the in-state answer rate is approximately 39%. So before, 100% of the callers were going out of state. There was 0 calls kept in state. And with just the 2 recent additions this summer, I believe in August, joining the Lifeline network, we're already seeing an increase in callers being kept locally and having their calls answered by someone who understands the Wyoming landscape. So just want to talk about the impact of COVID-19 on mental health generally. So we saw a Kaiser Family Foundation tracking poll from March 25th through March 30th of 2020 that 45% of Americans who responded to the survey reported that their mental health had been affected by COVID-19. And that's a pretty stark number. And as Lindsay mentioned, that it's one of the risk factors of suicide is financial stress or stressors, and COVID-19, as we all know, have brought on a number of stressors that that can be risk factors for suicide. A recent CDC report that was released in August, but completed June 24th through the 30th of 2020, found that 25% of surveyed young people between the ages of 18 to 24 reported seriously considering suicide in the 30 days prior to completing that survey in June 24th through 30th of this year. So that is an alarming, or certainly that is an increase that we want to make sure that those folks know that there are resources, suicide is preventable, and there's a resource available. And so one of the resources available to people who may be feeling distress related to COVID is the Disaster Distress Helpline, which is also administered by Vibrant Emotional Health. And it's really the line that we promote for people who are feeling stress related to COVID. So there may be, for stigma or other reasons, why people may not call the Lifeline. They may not feel like they are suicidal enough. So we wanted to make sure that there was a line available to help those who may be feeling distress related to any kind of disaster. And that's the Disaster Distress Helpline mission, to provide immediate crisis counseling for people experiencing emotional distress related to any natural or human-caused disaster across the U.S. And that can be large scale or small scale, natural like COVID-19, or drought in Wyoming, or human-caused, such as the school shooting or other man-made disasters. And so while the call volume on the National Suicide Prevention Lifeline has been relatively level, we have seen an increase on our Disaster Distress Helpline, which again is the helpline that is intended to, that we direct folks when they have distress related to a disaster. And so our counselors have reported callers expressing feelings of isolation and interpersonal concerns related to social distancing, which we like to call physical distancing, as well as financial concerns and managing stress related to work-life balance and homeschooling for children who may no longer be attending school in person but virtually, in addition to parents working. Concerns unique to COVID-19 relate to callers expressing anxiety and fear about whether they may have the virus or that they might get the virus. The Disaster Distress Helpline has a text function, and so calls and texts are often from people in otherwise good health, but though some people may have identified having underlying health issues that place them at greater risk, and that may relate to increased anxiety around it, whether they may get the virus. So I just wanted to share this survey, or kind of graphic that SAMHSA has on their website, which is adapted from research from Zunin and Myers, as cited in DeWolf, that really illustrates the phases of disaster. And one of the goals of the Disaster Distress Helpline is to help move people along the continuum towards recovery. But you'll notice here that there can be some emotional highs and lows as individuals work towards recovery and a new normal. So looking ahead towards kind of what 988 and other impacts to the Lifeline infrastructure We in an optimal world, for a really robust crisis hotline system, there would be national, state, and local level participation, and including funding that would utilize a variety of funding options best suited to responding to the local needs. And then, additional flexibility for states to build capacity around their unique mental health needs. As Lindsay mentioned, the culture in Wyoming is certainly may be different from the culture in Ohio or Florida or other states. And so states should have the flexibility to determine what works best for their residents. So with that, I'll turn it over to Richard to discuss 988 and looking ahead.
Okay, thank you very much. Can everyone hear me? Can you hear me okay? All right, good. I see a couple of thumbs going up on the, I don't quite know how to do that on the screen yet, but I take that as a positive sign. So let me go over a couple of things. I was also asked just to talk a little bit about SAMHSA's response to the COVID pandemic. And so there are a couple of things that I would mention about that. Obviously, it's something that SAMHSA is very concerned about. Under the CARES Act in March, SAMHSA was also provided with approximately $435 million in funding, specifically to assist in the COVID response. Of that $435 million included $50 million specifically for suicide prevention. Now, some of that $435 million has gone to things like grants to states as part of a COVID mental health and substance abuse emergency response, a significant expansion of certified community behavioral health centers, additional support to our tribal grantees. We have over 150 tribes and tribal organizations who are being funded through a program called Native Connections, and they all receive supplements to their grants to assist in COVID related response. Regarding the funding specific to suicide prevention, there are a number of things that I would mention. We awarded about a month ago 50 COVID emergency suicide prevention grants. Each of these they're 1-year grants, basically about $800,000 each to assist in the short-term response to the COVID pandemic. There was also additional funding that went to the National Suicide Prevention Lifeline and to Lifeline affiliated crisis centers. So this included additional crisis center follow-up expansion grants. These are grants that are designed to assist Lifeline crisis centers playing a more central role to move toward being the hub of a more integrated crisis system. We also provided funding to the Lifeline to expand its crisis chat service and to initiate a text service for the first time. And additional funding was provided to Vibrant to expand the disaster distress helpline that Laura was speaking about earlier, both in terms of expanding the number of centers participating and also to allow the existing centers who are participating to increase their staffing to answer the increased volume. Clearly, SAMHSA is very concerned. The CDC report was referenced earlier. That CDC report showed a significant increase in people seriously considering suicide, particularly young adults, people of color, essential workers, and caretakers, particularly unpaid caretakers, showed significant increases among a broader increase in the population. But it's really important to understand that the fact that more people, that a significant increase in people thinking about suicide doesn't mean that there has to be a significant increase in people dying by suicide. We know that it is very rare for someone to think about suicide and then die by suicide, immediately or shortly thereafter. Usually there is some period of contemplation or consideration or desensitization to the kind of fearsome idea of killing oneself, as Thomas Joyner talks about. So what that means is that there is time for us to act to prevent those increases in people thinking about suicide to become increases in people dying by suicide. Now, we know the overall trend in the United States has been up even before COVID. So obviously the concern is that the pandemic and everything associated with it, unemployment, et cetera, can intensify that. But, the part of the reason that the Congress passed and the president signed into law this additional funding was specifically to help us avoid that. So that's certainly a major priority for SAMHSA. Another major priority for SAMHSA is preparing for the coming of 988 as the national suicide prevention number. So let me just go over with you a few key facts about the move toward 988. Okay, so in July, the Federal Communications Commission issued a final regulation giving July 16th, 2022 as the date when every cell phone provider, every landline provider, every voice over internet provider in America has to make 988 operational. There is pending legislation, it's passed the Senate, it's waiting action by the House, relevant to this, but it's important to be aware that no congressional legislation is required at this point to make 988 happen because the FCC has already acted and all of the cell phone, landline, voice over internet providers have that responsibility to make 988 operational. If the law that's pending in the Congress should pass, that will do several additional things, including having SAMHSA and the VA giving us 6 months to provide a report around the resources that are needed in order to implement 988 well. One other thing I would want to mention about 988 is that it's sometimes there's a misunderstanding in some places that nothing will happen until July 16th, 2022, and that at that point, all across the country, 988 will turn on. That's not the case. That is the last date by which all of those providers have a regulatory responsibility to make 988 operational. Some of them will make 988 operational in advance of that, and in some instances, perhaps well in advance of that. Right now, as we speak, 3 different providers have already made 988 operational. They have small customer bases in some places in Los Angeles and Sacramento and in South Dakota. So 99.9% of the American population at this point in time does not have access to 988 operationally. So our messages continue to be call the National Suicide Prevention Lifeline at 1-800-273-TALK. But over the course of the next 2 years, it will become increasingly operational in different places. I'm not sure how much of an issue this is in Wyoming, but in rural areas in particular, there are places that have where the switches for the landlines have to be upgraded in order to accommodate 988. And that'll happen kind of one at a time over a period of time. A big impact will be when the major cell phone providers make 988 operational. So it's not really the case that we don't have to think about this for 2 years. In fact, we think it's important in every state that people are thinking about 2 things. One is the core responsibility of if we fully anticipate that 988 is an easier number to remember and more people are going to call. So we want to make sure that those calls get answered. And we're so grateful right now, as Shari mentioned and as Laura mentioned, that now people in Wyoming calling the Lifeline are going to get their calls answered within Wyoming. I think that's hugely important. But we anticipate even more callers from Wyoming will call once 988 is made operational. So the basic thing, the core responsibility is if more people call, we need more capacity to answer those calls. The second is that many people are hoping that 988 will play a transformative role in mental health crisis services in a way that's similar to the way 911 played a role in transforming emergency medical services across the United States. Of course, those changes took place over a half century, and we're talking about 988 over a 2-year period. So we're encouraging conversations going on with states about what will work best for them. It's also important to know that the language of the FCC order and of the pending legislation in Congress, should that pass, that suicide prevention is the core responsibility of the line. But it also speaks more broadly about mental health crisis services. And some have even asked about substance abuse crisis services. So for this more expansive vision of the potential for 988 to take place, we all need to be involved, we all need to be engaged, we all need to work together on both the federal, state, and community level in order to make this occur. So I'm going to stop there, but that's an overview about some of SAMHSA's efforts in response to the COVID pandemic, and also some of our efforts and conversations on an ongoing basis. We have calls every 2 weeks with the FCC and the VA on this as we move toward full implementation of 988 across the country, which will be here before we know it. So thank you.
Okay, I don't know, Laura,
Yes,
who's gonna go next?
I think
Or
that is
we're
our
done?
presentation. Yep, that's our presentation, and we're happy to answer any questions.
Awesome, great. Well, I'm gonna open it up for Q&A, so feel free to unmute yourself and speak up if you have any questions. This is definitely the presentation to get your biggest suicide prevention questions answered.
I just had a question. Do you know what hours in Wyoming the local crisis centers aren't available? Like what the hours that they do get rerouted?
Yes, I do.
Oh.
So the Henny group is currently answering from 8 to 5, Monday through Friday. And Central Wyoming is answering calls from, I think it's 4 to midnight, from Wednesday to Sunday.
Oh, cool. That's a lot of hours.
Yeah. The only thing I want to caution you with is we have had some issues with reporters in the media saying, hey, here are the hours for the call centers. And then people are like it can send the message, okay, well, I can't call, you know, if I have a crisis, not during those hours. And so just be careful in how you share that, because we don't want, the last thing we want to do is discourage anybody from calling.
That was personally for just personal curiosity is all.
Yeah. Oh, I figured.
The 1-800 number is available 24/7. as Lindsay mentioned, there are operating hours for our 2 call centers in Wyoming, but we are working with both of them and the department to continue to expand coverage for what, to ensure that we have more access for Wyoming callers, but callers at any time of the day, any day of the week can call the 1-800 number and reach.
Thanks, Laura. Does anybody else have any questions?
And I'm certainly, this is Richard McKeon, I'm certainly willing to, answer questions on topics beside 988 if there are other questions about SAMHSA or national suicide prevention efforts.
I know some of you have to have questions because you email me every day with questions. Some of the people on here. Oh, perfect. Okay. So Donna says thank you for the detailed information on 988 legislation, and that she will refer to that information when encouraging her representative to support it.
Yeah, and the name of that is the National Suicide Hotline Designation Act for that. And while as a federal official, we're not allowed to call for the passage of any specific federal or state legislation, I am allowed to tell you what the name of it is.
And I see that Ralph Westerman,
Yes, I was just going to say, go ahead.
yes, of the Henny Group, Wyoming Lifeline is on the webinar today. So I just wanted to thank him and the center for being a part of the Lifeline.
Yes, and also Ralph corrected me. Go ahead, Ralph.
We want to be able to start at 8 a.m. Right now we're starting at 12 a.m. and our goal is to get there to 8 a.m. So that we do provide service that matches up and complements the service hours that CWCC is, because our goal is to get as many calls answered here in state as possible.
Thank you so much, Ralph.
You're welcome.
I'm sorry for...
Gave me a chance to say something.
Awesome, love it. All right. Richard, I'm interested to hear your thoughts on some of the other challenges that I was talking about that we face in Wyoming, and what we can do at the community level to address some of those challenges. Things like social isolation, things like access to lethal means, and working with different workforces and people losing employment.
Yeah, I mean, those are all really important issues, for sure. I think with regard to social isolation, and obviously that's an issue across the country, particularly because of the pandemic and for older people. And older people obviously are at higher risk for suicide to begin with, and maybe less, facile with social media and some of the ways that younger people are able to stay connected with each other. So the idea of, finding ways to check in with people who may be isolated or vulnerable is really important. There was an intriguing study a number of decades ago from Italy, and it was Diego De Leo, and it was a telecheck service for elderly people in Italy, and they showed a reduction in suicide using this service. And this was basically, people calling older, Italians in the community, who were isolated, who couldn't get out for, perhaps because of physical health reasons. So I think anything that increases the level of connection, certainly shared activities, there's reason to think that activities that feel meaningful and that are shared is a useful way to bring people into connection, with each other. I think that, obviously lethal means is a huge issue. The SPRC has a course, as many of you are aware of, called Counseling on Access to Lethal Means, focusing particularly on the idea of if somebody's thinking about suicide, that they don't have immediate access, whether because, and we know that about 51% of the suicides in the United States are using a firearm. But whether it's a firearm or pharmaceuticals, or suffocation, the other major means, finding ways to reduce that access, is important. Whether it's gun locks, or other means of safe storage is one important area. And I think it's particularly important, and many states have moved in this direction, in terms of trying to set up partnerships with firearm groups. The Gun Shop Project that started in New Hampshire, been used a lot in Colorado and in elsewhere, I think is a good example of that. The state of Washington was able to set up a commission looking at lethal means and suicide prevention that included firearms groups. It was supported by the NRA, and part of it was that they were not singling out guns and firearms. They were including the broad array of areas where lethal means is an issue, which can include, of course, overdoses on pharmaceuticals or overdosing on illegal drugs in an attempt to die by suicide. But it also includes things like suicide on the railroads or on bridges and so forth. So bringing a broader group together is to work on these issues is important. So I mean, those are certainly some points. And you mentioned that unemployment, and there is an established relationship between unemployment and suicide. And researchers may differ on the exact magnitude of that. And we know it's not unemployment alone. It's coming together with other factors. Someone may lose their job, start to drink more, become depressed, and these factors all come together. Also recent research has suggested, particularly in the area of homelessness, of being aware not only of the impact of things like unemployment or homelessness, but actually for homeless veterans, the period of highest risk is a period just before homeless. So if somebody's threatened with eviction, but it hasn't happened yet, that time when looming before them is something that they are dreading, that is a particularly high risk time. Certainly working with, we have not done a lot historically with workforces and suicide prevention, but more is being done now. The Action Alliance is involved in that. The construction industry has been doing a lot in that area. Police and other first responders have been involved in that, the International Association of Chiefs of Police. So we don't necessarily have completely validated evidence-based practices in each of these areas, but I think we do have promising approaches that can be utilized as part of a comprehensive approach to suicide prevention.
Thank you so much. So you brought up a couple things. First, the study in Italy. Actually, last year at our symposium, we had someone from the national office from AARP come to present about different issues related to older adults. And she told me that they had funded a pilot program in Los Angeles, and it was for the retired Screen Actors Guild members. So a lot of them were in like worked on the film side, sound, whatever, in the movies and television. And what they did is a similar setup. They had a phone tree basically, and they would call once a month just to check on each other. And they had expressed some interest about us potentially partnering to try and pilot a program like that in Wyoming. So I think
Well, that would be great. And we keep on learning more about the importance of peer support. Whether that's in the context, for example, of veterans helping other veterans or in other areas, but there are challenges in having enough mental health services, in every community across the country. And I think that just underscores the importance of the way that peers can play a role. And, and as another example, in many of the crisis centers who are part of the National Suicide Prevention Lifeline, a significant number of them rely heavily on trained volunteers because there simply aren't enough psychologists such as myself or, psychiatrists or psychiatric social workers to meet all of these needs. So peers are important, trained volunteers can be utilized. These are all important ways to, extend our reach as part of a comprehensive effort to prevent suicide.
Absolutely. And if anyone is on the call and they're interested in work around working with different workforces and suicide prevention, I've been partnering with Meredith Toll from Workforce Services, and she is getting some of the information from Dr. Joe Grandpré relating to VDRS and figuring out what workforces are more impacted by suicide. And we're hoping that we have a state crisis response team. So we're hoping to partner all of us together to be able to address things like the closing of a mine or something like that, so we can provide mental health care services to those employees that have been laid off or furloughed. So just reach out to me directly if any of you guys are interested or if you have any contacts with a specific industry in Wyoming. All right. Well, I want to say thank you so much to Laura for helping put this together and just being you and being amazing. Every time I talk to you is a joy. And Shari, thank you for joining us. And of course, Dr. McKeon, thank you so much for taking the time out of your schedule to join us today. Really appreciate it.
Thanks
Absolutely.
for having us, for all the work that's being done in Wyoming.
Thanks for supporting us. All right. Bye. Take care.
Bye-bye.
Everyone.